I'm seeing more men than ever in my plastic surgery practice, and one procedure in particular is becoming the most rewarding thing I do for them. I'm Dr. Mike Nyack. I'm a board-certified facial plastic surgeon in St. Louis, Missouri, and I specialize exclusively on surgery of the face and neck. Over the last 10 years, I've seen a real uptick in male patients in my practice. They've become a lot less skeptical of plastic surgery and a lot more accepting of it. And there's one procedure in particular that I have found really changes their lives. It's a deep neck lift plus or minus a chin implant. In young men in particular that are 20, 30 years old, that are physically fit, they're athletically fit, but due to poor genetics and no fault of their own, look like they're really heavy or that they don't have a strong, determined model jawline. When I give them that neck shape and the jawline shape that they didn't get genetically, it literally changes their lives. So I have a great example. He's become a friend of mine now. His name is Bobby. He is a working actor, singer, model, dancer, and he had real problems with casting. His agent literally told him that from the neck down, he looked athletic and muscular leading man, and from the collarbones up, because of his genetic build, he couldn't get the roles that he wanted to get. And when he and I talked, I kind of joked. I said, from the neck down, you're a football player, and from the neck up, you're a football coach. And we wanted to fix that. And so what Bobby got is what is becoming the most common reason that men travel to me from around the country, around the world, and it's for a deep neck lift. And a lot of people think that we can create this shape by doing liposuction. And you really can't. The neck is built in layers, and liposuction can suction the fat immediately under the skin. Just like with your belly is built in layers, liposuction can suction the fat just immediately under the skin. But there's a lot more going on in a genetically heavy or a genetically oblique neck. So just like your belly, if you're pregnant and there's a baby behind your muscle layer, you can't treat that by liposuction. You have to deliver the baby, and then the waist gets narrower. Well, the same thing with the neck. We have to go behind the muscle layer and sculpt a true shape in there, and sometimes actually build the chin as well. If that's really soft, there's only so much you can sculpt. We need to build the chin forward to help create that shape. In Bobby's case in particular, he was looking for leading man roles. He has a huge frame. He's over 6 feet tall. The top 2/3 of his skull are really strong and boxy. We need actually even a little stronger chin in him so he looks like that leading man, that Superman character. And in this context, we've combined that deep neck lift, which is the most popular procedure men travel to me for, with a chin implant that's a little bit on the stronger side, and he looks like Captain America. I mean, this is the kind of change that will change his life. It will change his social life. It will change his career opportunities. It's an investment. Bobby is actually going to do better in practically every aspect of life. And I can see the comments already, how unfair that is, and why should someone have to have surgery because of what society thinks. And my response is, it is totally unfair, but it's actually real. And if you're going into a career where your appearance matters and you're a performance artist, these are things that you do. Just like if you're an athlete, you eat really well and you exercise really well. These are things that you do to bring your form in line with the top of your career. So the deep neck lift is, I think, the reason that I see more and more men these days, and it's becoming much less taboo of a subject for men. The other nice thing is men have a little advantage when they're recovering from surgery. When they recover from surgery, I tell them not to shave for a few weeks. It helps hide the bruising, the swelling, and then by the time they actually do get to shave 2 or 3 weeks later, most of that's gone, and the only thing people notice is, oh, thank God you got rid of that terrible beard. Your jawline looks so much better. Here's a good example of a young man that came to me for a rhinoplasty and a chin implant. While he was there, we also did maximal liposuction of his neck. In his after photo taken 1 year later, his nose looks good, his chin looks good, but there's not much difference in his neck. And that shows you most of what needed to be changed wasn't just what was suctionable, it's what's deep to that. So in this next after photo, I've done a deep neck lift on him, and it's a complete transformation. We've sculpted the fat, fibrous tissue, glands, and muscle deep in the neck, and it's given him the jawline that he's always wanted. So the next two most popular procedures I perform in men are rhinoplasty and lower blepharoplasty. Rhinoplasty is more like the deep neck lift. It's transformative. It changes a feature they were born with and don't like into something that they like more. Lower blepharoplasty is more restorative. I see that more in the 30s and 40s, and it's making the eyes and mid-face look a little more refreshed, getting rid of the bags and dark circles. Both of those procedures, I find, give people more confidence and make them feel more confident in social and professional circles. I hope you found this information helpful. If you did, hit that subscribe button and turn on the notification bell icon so you can see my future content.